So hello, everyone. Good afternoon. We'll just start with the introductions and then a little bit about affinity groups and spaces and how we kind of will spend our time together today. But I'll start. My name is Sarah Williams, and I am a collaborative consultant at the Jackson Collaborative Network, and I do this work alongside Amy.
And I am Amy Forrs, also a consultant with the Jackson Collaborative Network, and excited to see some new faces today. I'm also going to mention that I do need to cut out a little bit early, so I apologize, but I am going to cut out a little early, and don't be offended.
I'm already offended.
I know.
Hello, I'm Angie Shepard. I'm a program manager with Region 2 Area Agency on Aging, and it's been a couple months since I've been in this group, but I have been a part of it in the past, and I try to. I just have Tuesdays are rough days for me, but I'm glad to be here today.
Thanks for being here.
I'm Angie Guadagnini with the Department of Health and Human Services. I'm the Community Resource Coordinator, Contract Monitor, so I'm here.
Good to see you.
It's down to you and I, Ann.
I'm sorry. I thought you were going to start speaking. You can go right ahead, Elliot.
No, it's all good. All good. Elliot Emmerich, Network Development Director for a company called Unite Us. I'm just here to learn a little bit more about what this group does.
Thanks for being here.
And hi, I'm Ann Sloan. I'm the Community Health Coordinator at the Jackson County Health Department, overseeing Children's Special Health Care led early on Part C coordinator, maternal infant health program, and fetal infant mortality review.
That's great. Well, thank you everyone for being here. We always say we have slides and it will kind of help ground us, but a lot of the richness and meat of the group tends to be group discussion. So we'll start with slides, especially for people who are newer or maybe haven't been in a while, to kind of ground us, remind us where we are, and then we'll get us pointed in the right direction. So if all works well, I will share a screen.
Fingers crossed.
So here is we've already kind of done welcome introductions. This is just kind of a description of the group. We have different spaces that we host. Right now they're, I will say, virtually, and hopefully, fingers crossed, that maybe in the future they will not be as virtual. We've started doing some in-person small meetings, like with community partners, that has felt great. But this group, affinity groups, are really designed to build capacity and support conversations among you all. So as community partners, we're creating a space for you all to come together to talk about what you're working on in your organization, successes, challenges, barriers, you're stuck or you had a great success. All of it is really how you all can move your strategies forward in the work you're doing, and how we can help best support you and create a space to connect. So we host 3 currently. This one is around making service systems less difficult to navigate, and service systems can be defined super broadly. It kind of is intentionally, because a service system could be maybe at DHHS, or maybe it's at schools. Maybe we had, I think, like someone from like employment service navigating. It can be really anything, but the idea is that if you all are working on strategies that kind of center around this, likely you'll have connections or maybe successes and ways to partner with each other around this root cause. Amy and myself are here to facilitate and to support the conversation. Depending on how many lulls there are, we might throw in some little nuggets. Sometimes we don't, because it's not needed. And we love to hear the rich conversation that you all have and connect with each other. I don't know if there's been an affinity group that we've had where a connection hasn't happened later or outside of the group, which is lovely and ideal. Amy, do you want to jump in?
Sure. This is just kind of the process that we think about when we're looking at affinity groups and really work in the network and becoming network partners. So the ideal is to really gain an understanding the skills that you need to drive system change. That can be a very broad term, but really, so often in the work that we do, we put strategies in place, but we really want to work deeper to get those strategies to be meaningful, to really understand it. We have a whole action planning process to get down, using data and measurable outcomes and things like that. So that is where we can assist you in these spaces. And then Sarah mentioned connections. We really find value in not going alone and kind of building off of each other, using each other's learnings and things like that. And building relationships, both with other folks in the community that are doing this work, but also with people that are closest to the problem, really getting down to those deeper barriers that people are experiencing. We find so often in the work that we do that we make assumptions on many levels, and we design action around what we have decided they need. So it's really kind of building relationships, encouraging to build relationships with those with lived experience, and really getting into the, finding out what's going on in the community versus just making assumptions. So, and then there's always the tracking and measuring progress. So we have dashboards, we have goals and objectives in the network that we really want to align our work to, so that we can make sure that we're actually moving the needle on some of these deeper issues that are happening in the community. So we will kind of push folks to say, how do you know if you are successful in the strategies that you're building, and really kind of contributing to making our community a better place.
This is just a group norms slide. If you all have been a part of groups before, sometimes they put norms out, but we really like to have a space where people feel comfortable putting ideas on the table, asking questions of us. We want to have a space where we can ask questions of you. For example, if Angie's like, oh, I am having this barrier, but the reason is because this policy has been in place forever, we might say, are you sure it's in place? Or why is it in place? Or do you have any power around that, right? So we want to create a space where people feel comfortable asking questions, and of each other too, right? Like maybe like, oh, Angie, tell me about your success that you had, or actually this way doesn't work very well. I'm just here to, this was my barrier. So, and then also obviously presuming positive intent about others, asking clarifying questions, and taking care of yourself. Also super important. Any questions about that? We'll just move right along. This is just an example of a moving to action, different ways. I think we've talked about them a little bit already. Different ways that you can be involved in the network, or how we can be involved with you. We have a partner profile page that really is, I know some of you have entered your information. We have a screenshot of it here, but really is a place for you to enter your name, your agency, your email, and then a couple sentences about the work you're doing in the community. So it's not organization based. Like if Elliot is working with 3 other people, you would each have a partner profile, but it really helps us understand what you're doing in the community. It doesn't have to be, can be as detailed as you'd like it to be, and then also the root cause or causes that it ties to. So we have, I think, like, I don't know, 40-ish profiles listed. And we can sort through them by root cause. So we know that 50% of people who've entered information in are working on things around failure to acknowledge bias and lack of equity and respect. So we might take this data and decide to meet around it, or maybe people are telling us we're working on this, and maybe we should, like, is there an expert or someone that we can bring in, right? Like to talk about this big picture, but we are looking to like learn about the work you all are doing. And this is also a public facing page. So for example, Angie could get on and say, oh my gosh, I didn't know that Terry was working on strengthening outreach and building trust and transparent relationships. I'd like to reach out to Terry, and the email is right there. So you don't even have to consult us if you don't want. We're happy to be a facilitator as well. But this is a public facing page. So I put the link there. Also, you will receive a link from us in the follow-up email saying, it's like a gentle stalking, you know, like, it's like, hey, we would love to know what you're doing in the network, in the community. And then also I'll say too, like, I don't know all the things that are happening in the community. So it's very helpful for me to know and say like, oh, actually, I didn't know that was happening. I can help make a connection later, you know. Oh, yes,
sorry, I'm going
please.
to just jump in. Now,
Yep.
the partner profiles also help us know how we can best support organizational work. So Sarah mentioned the root causes. There were 14 that the community kind of came up with when we did system scans around what were really causing true barriers. And so they might tie with multiple root causes, but once we see, those are all tied into our shared measurement system. We talked about that, you know, making sure that we're making progress. So those all tie in, and we can see that we've got, you know, 7 partners that are working around this particular root cause, and that is moving the needle on that outcome. So it's yes, an easy way to connect with people and to find out what work is going on, but it also helps us best understand how to support and what to kind of gather people around and where the momentum is happening in the community. So, sorry.
Oh, that was a good addition. Thank you. We also have listed here engaging in affinity group discussions. You're in one right now. We have 2 other ones currently that meet around building trust in the community, and also inequitable policies and practices, and what strategies are being built around to remedy that. We also have possibility/plans to launch a 4th or more affinity group this year, depending on what people say they value, because we are looking to support people in the best way they want to be supported. We also have action plans, and action plans are really unique to each partner. So if Angie were to say, hey, actually, I'm working on trying to edit this policy because it actually doesn't support this population as much as we thought it would, then we could say like, okay, let's sit down and figure out what that looks like. Do you have data? Have you, you know, what are some things that could be barriers? You know, there are, we like to say like thought partnership, happy to be a thought partner and help you move the needle if you're kind of stuck in a thing, but really is strategies around these that are tied to the root causes. For sure, track and reporting progress by either updating the action plan or reporting out in an affinity group setting like we do when we meet regularly. We always talk about successes and not. We also have wins, which we can talk about later too in our database. And then just kind of sharing those pieces with us and the other people around you, all the other network partners, so that we can all learn from each other. So this is just a quick snapshot because these affinity groups meet monthly, and we tend to have some people that come every month. Well, schedules are hard, right? Like we will not pretend that it's easy to attend any regularly scheduled meetings, but we have people that attend often and some people that pop in or out or schedules don't allow. So this is just kind of a reminder that we have had conversations around what are some strategies or barriers or things that have popped up regarding trying to make service systems easier to navigate. And what are some things that, and these, what you're looking at is it's a screenshot of notes that I take in Padlet. It's not official because it's really not intended to be, but just a reminder of like some of the things we've talked about in previous months, and like either there could be an update or not, but also that we're not really starting from scratch. Although if we have, yeah, I don't know if I said that well, but So last month when we met, Angie was talking about an increased amount of applications that were coming in, a continuum of care really around housing. We had a big talk about housing. And really that can tie to a lot of things. I think it's a good example also of how sometimes the root causes overlap. Often they do, right? Because if you think about housing in general, that's not even like a root cause, or it's not even a problem statement. It could be that like a problem statement is African-American, city of Jackson residents this age are experiencing a higher rate of homelessness when compared to blah, blah, blah. Like that could be a problem statement, right? But then they're like, well, why is this happening? Is it because service systems are difficult to navigate? Is it because there's a policy that's inequitable, likely? Or is it because, and then can you get down to trust, right? So these are an example also of that there's not really a right or wrong answer to these conversations. It really is also a place for messy conversations. I don't know if we've ever had not a messy conversation.
The best ones.
They are. And then just in previous months, we've talked about other challenges around like, it's difficult to track young people in the skilled trades, or a barrier to systems could be best practice is this, but policy says we have to do this. So like, how do you support people or consumers or patients when you don't have alignment? We talked about affordability being a factor when you're navigating service systems or trying to help people, and where's the control versus influence versus, so this is just an example. Not all of these people are here today, so we're not trying to like get an update, but just some things that we've talked about, and then some things that have led to connections in previous meetings. Did I miss anything, Amy?
No, I think you've covered it. It was just a good overview of kind of the directions that we've gone, but we're kind of excited to find out where, from folks that are on the call, kind of like you came to this meeting, so like this is clearly something that you've experienced or have seen people experience in your organizations. And so I'm kind of excited to find out where you're at, or what kind of barriers you're experiencing, or even throwing out a problem statement, right? So that, I'm seeing this, and then kind of bouncing off each other to find out what's going on. So
I'll switch over to Padlet so you all can see my incredible note-taking abilities. And then, and I'll just capture whatever we talk about, including the comments that we all contribute and thoughts. And if I didn't capture something correctly, you're welcome to correct me. I feel really strongly about making sure things are captured well.
So this is where we go mute and you guys come off mute.
So I'll start. One thing that came up with staff, I'm meeting with each of our each of our units in the whole building about my role in the building. But one thing that came up is when we make referrals to, for instance, community action for their housing assistance, there are other criteria that need to happen. So before you can apply for this, you have to apply for that, but that's not clear. That's not clear to staff when they make the referral, so that the client ends up kind of running around. And it's not just for our staff, it's anybody that we are sending. So our second floor, when somebody's applying for state emergency relief, for housing, we're sending them to community action housing or whatever, and they're coming back and telling us that really isn't how it works. You have to do this, this, and this first. So it's not really clear on their website even how that works. But so when we're sending people, they're getting lost in the shuffle of getting to the resources that they need.
And that just puts not only the barriers to getting what they need, but now there's lack of trust. They're frustrated. They don't.
Yes. And it's not just community action is the first thing that popped in.
Mhm.
It's all over. So Lifeways has processes, and Community Action has processes. Salvation Army has processes. So all of these resources that we recommend for folks, there's processes to go with them, and sometimes those processes aren't explained clearly, even for those of us who are intelligent enough to follow through. So when we get to those folks who are struggling with food insecurity, for instance, when we throw out a whole lot of information to them, it gets lost because of the chaos of what am I going to feed my kids tonight? I don't have time to think about and jump through all of those hoops. So I think recognizing that our clients are sometimes their thoughts are more chaotic than stable.
Angie, what are those referrals going through? Like, are you used in the care hub?
No, we don't use the care hub. We use My Bridges.
Okay.
The referrals that I'm talking about really are from our staff who are working with those families directly. So our staff is saying, so housing, I tell people you need to go to the Housing Commission, apply for Section 8 when that is open, to apply for subsidized housing. I send them to Community Action because they can help with sometimes paying for first month's rent deposit, application fees, that kind of stuff. And so staff are doing that, but then they're being told that they have to jump through hoops A, B, and C. So now I'm telling them they have to jump through hoops A, B, and C, and it's becoming a bigger issue than just making a call and helping that person get connected, because now they have to connect them to before they can connect them there. So, and it's not just us. It's not just either of those organizations I've mentioned. Those are just the ones that popped into my head, but it's frequent that there's more steps to getting things done and people are getting lost in that shuffle.
Well, not only that, those hoops can be really big hoops. And
Yeah.
what I mean is, like, if you need a birth certificate to apply for assistance in whatever realm, I mean, Salvation Army requires like household verification and birth certificates and all types of stuff. And a lot of people don't always have that readily available. And that's not just something you can get the same day.
Yep.
That's interesting that you mentioned that, because I don't know all these requirements, obviously. But it makes you, right? Like, it makes you wonder what can be done about that too, right? Because I have a feeling that none of us here, well, maybe we could petition Salvation Army to like change their requirements. Birth certificate, that's a wild requirement. Like, that is hard to get and also hard to assume. That's interesting.
Yeah, and when you don't have a lot of resources or means, $10-20 to pay for something to get it done is a lot of money when you don't have any money.
Love Inc. can help. Love Inc. can help get those birth.
Yes, they can.
As well.
Yes.
Yep. But it's a process. It's not like I can go to Salvation Army and just apply. I have to go through Love Inc. to get the birth certificate, and they've got forms to fill out, and there's the other stuff too. So our systems are they're just very cumbersome for our families that are already struggling.
And some organizations limit the amount of times like that you can access, like Salvation Army. Is it still 6 months?
I don't know about that, but yeah, there are limitations.
Yeah. And that may have changed. I just, a while back, I just recall, Salvation Army had a clause that if you received food assistance within 6 months, you weren't eligible. Like you had to, it was like basically twice a year you could get food assistance from Salvation Army. Don't quote me on that being policy now. Just, I remember that from previous experiences.
I think you're right.
It's so interesting because my immediate thought then is if I were someone that was trying to refer a person for assistance, I would probably avoid. So I would probably try and like find other places before I jump to Salvation Army, you know, like, it's interesting because when you're talking, Angie, about like, everyone has different referral processes. I've been, I've been sitting in, I've been a part of the whole child group
Mhm.
through the ISD for a while. And one of the things they were working on, similarly, I mean, obviously your resource examples span wider than just mental health,
Mhm.
substance use, you know, but they are
Yeah.
working, they have created a universal referral form, and I shouldn't say all, most of the local mental health provider places have kind of like signed off on it, saying, yes, this meets our requirement for our agency. And so if you send us this form, we will accept it and it meets the things. And I also know that it took years to get there. But when I'm thinking about, like, you're saying all these things of, so again, we'll use community action because they came up, but um, is there a way that do they know that their process is not being displayed clearly?
So that's the thing. I don't know that. This just came up with one of the meetings I was having with staff, like last week. So I haven't had a chance to say anything to them. But I know the staff has talked to them, because the staff are very vocal when they're helping with their families. They're very vocal about talking to whoever they need to talk to get the needs met for the people that they're working with. So, but I don't know if leadership is aware that there's concerns.
You said that you are going to investigate that part?
I am, only because I work with Toby on the COC, so I know her, so I can address and say that this has been an issue with folks that we've been sending. So, and I know that they work really hard at making sure that their access is open to everybody. So no, they work very hard at that. So if we're having a good number of folks that are still struggling with it, then I know that they'll address it. So, so yeah, I'll be talking with Toby about that.
I wonder if it would help to reach out to the whole child and find out what their universal screening form looks like. Because I bet that they've gone through a lot of work to make sure that it covers what most of the agencies need it to cover.
Well, they've got all those people at the table, right? Because obviously, if you're going to say, yes, Lifeway signs off, yes, you know.
Is that through the Care Hub?
I don't have an answer for you on that.
Okay.
Because all I remember, I was definitely in on the plan, because they've got subgroups too, you know. And so what I have I have been popping in and out of the mental health lead group a bit. And they were kind of drafting this. And I know it's been years, because like you start a thing and then they're like, no, this doesn't meet this. And I don't know if our board is going to approve this. And I'm not sure if we can have this, but they got to a place where I think I have a draft of it or maybe the final, but like, this form, we all agree because of this exact issue. And I know you're bringing up housing and like different services, right? But to be able to say, well, is there a way that all of the housing places could come together and say, yes, we all agree that, you know, here are the things that we can't compromise on. They're absolutely mandatory. And are there places, I think, because of that process that the whole child did, some of the agencies like edited their requirements, right? Or made it like, yes, this is a good enough starting spot to accept a referral, and then we'll take them and find out more. And I just wonder if this is a legit thing, and if this is a true barrier, I wonder if this could be done in other sectors too.
And I feel like they did this at the health department a while back, did a universal, and correct me if I'm wrong, but there was this, like, they had different screening forms for different departments, and they ended up making one universal one that everyone said that they would accept. You remember that? It was
We have like an internal referral form, yeah, that has, yes, that was several years ago. It was a, kind of just, we have like an external and an internal referral form that is not consistently used, over the years. It's kind of, yeah.
Because I feel like some of the external ones needed to be like okayed by some outside agencies, right? So like the hospital had to say, yes, no, we need this number and that number, or this is sufficient information, or yeah, but it was some many
I
years back.
recall that. I think Rhonda may have worked on that a little bit and done some outreach, like, with some external agencies about what information, they would provide. And, we did address something similar at one point. Yeah.
But it's not used a lot.
No, I mean, we've had so much turnover over the last couple years. There's staff that majority of people don't even know it exists really. Like we have we have a referral form that gets used, like MIHP, for example. WIC is a very involved program that refers a lot to us, and they just have copies of a form that we use internally and they send them upstairs. Other than that, in regards to like the services we have in PPH, like children's special health care and early on, we all refer to each other. But like, I don't get referrals for any of our PPH programs from environmental health. I mean, like things of that nature. So there's that, I mean, a bit of a disconnect. So the programs that make the referrals, they use it. It's just a kind of a standard demographic form. And the advantage that we have with that is we can have those internal conversations. Right. So, I mean, you can do that warm handoff if somebody is available as well, which kind of helps facilitate that process and getting somebody enrolled in another service. It just depends on the circumstances, but yeah, we do have something internally that we use.
Yeah, I'm kind of like racking my brain, kind of thinking about it. And I'm not super familiar, Angie, with the My Bridges, but I'm wondering if when you enter a referral, if it could like automatically populate these two qualifications, you know what I mean?
So that's the question that we've been having. So the community linkages, the Care Hub, we don't participate with the Care Hub because we have a lot of that is already built into My Bridges, and we felt it was redundant. And on top of that, our legal group in Lansing wouldn't allow the participation because of the confidential information that is shared. So we don't use the Care Hub. Now, when we refer to other agencies, we're not using the Care Hub, even though folks have that opportunity to use the Care Hub, and but we don't. So the information that gets shared is very minimal because of the strength of our confidentiality policy, mm-hmm. Which it's pretty stringent.
Yeah.
With
those policies,
yeah, it's a strong policy, and it needs to be, especially when we're talking about child welfare and the reasons involved in child welfare. So we have to be very cognizant of the information that we're sharing, and the families that we're working with, they have to be involved because we don't know their histories and whatnot. So they have to be involved. And if they're overwhelmed with the process, they're not going to follow through, and they're going to be back in front of us again. And we don't want to see that recidivism. That was weird, Sarah.
Sorry, I know, I heard a ding and then I clicked over to my other page, and then I was like, oh yeah, I can't do that while I'm sharing screen, can I? Forget all the roles I have to have when I'm sharing screen in a meeting.
I am curious, when I'm part of this group, what I like to hear are the strategies to work around making those systems easier to navigate. So so I know our systems are problematic to a lot of people because we require birth certificates, we require proof of income, we require proof of housing, we require all of those things. So just so that, you know, Angie and Ann, who haven't been as active in this group, just, you know, that you don't have to have the fixes for all of the issues that people have. I like to learn what are some of the barriers that your folks are seeing so that we can address them on our end. Because I think that's part of this whole process of making these systems easier to navigate is what can we do better? So, Anne, if I'm working with the health department, I might call you and say, hey, look, this is what's happening with the folks that I'm referring to your MIHP program. How can we make that an easier transition for folks? And I think that's the whole point of this. And I enjoy that. And I like that because I can go back to our staff and say, hey, this is what I learned today, and to make things easier. So when I talk to Toby, I can say, okay, so what would be a better way that we refer folks to you? And, you know, is it easier if we just send them to you outright, or should we do some work with them first? Or, you know, what can that be? And then I can share it with you at end of the next meeting so that your folks can learn that as well.
No, I think that's a great point that you make, Angie. And obviously, like, these groups are like, so much of it is connecting and et cetera. But there's also a chance that both Angie or Ann may not have any input regarding, you know, DHHS referral pieces. And so, yeah, we'd love to hear the connection if it is relevant, or if they have thoughts. But really the whole point of our conversation, because Angie, the other Angie, might actually have some thoughts that she's working on making service systems easier to navigate within her organization. And then, right, the strengths and challenges, and they may have nothing to do with universal screenings. It is that, right? Because that's just what comes up. So absolutely, if there is a connection, and if there is some, ideally, if someone has something to contribute to, here are my thoughts with DHHS, right? But really, these conversations are, and we just got one, you just explained a barrier that you've got, and we have a next step captured, right? Because you're going to talk to Toby and like let her know this thing is happening. And so by the time we meet again, you will have an update, you know? So I just want to make sure that we highlight the connection piece, and yes to connection, of course, but that also, it might not be, does Anne have something to contribute to DHHS? It might just be that Anne actually is working on something internally at her organization around navigating service systems, and it may or may not benefit you at all. Right. So I just wanted to make sure that we made that part clear around the conversation. And of course, the connections always happen, you know, as well.
That's really helpful to know, Angie, because staff will have conversations about different organizations that they're trying to connect people with, and if there's an opportunity in this environment or another meeting, that's always good to keep in mind. So I appreciate that, and I really appreciate understanding why MDHHS was not involved with the Care Hub. I thought it had something to do with redundancy, but the legal piece makes a lot of sense. So I appreciate understanding that, because I was wondering, because I mean, you're kind of like the hub, you know, for the county in terms of assistance. I mean, that's, you know, I mean, cash and food and housing and emergency. And so not having that intertwinement, I was like, well, goodness, you know, what's behind that? But what you said makes absolute sense. So I appreciate having that understanding.
Well, good. You learned something today. Yay.
I did. So thank you.
We're still involved with we're still involved with the Care Hub in the sustainability and the management of it. We sit on that sustainability committee, that group. But as far as participating in it, we get referrals periodically from folks, but because everybody knows DHHS is where you go for food assistance and cash assistance and state emergency relief and Medicaid and all of those things, it is redundant. And the 211 is part of my bridges as well. So where the care hub is really linked to 211 to make referrals easier, we're linked to 211. But the family has to self refer. So sometimes having that person holding my hand to help me walk through that process, it makes it easier for them.
Well, that's certainly good to know, because I've been logging into that recently, and they're all food referrals, and I'm like, I can't help with a food referral unless they're WIC eligible, you know? So
Yep.
yeah, that gives me some insight. That was very much needed, because I was really confused. So I learned something. So thank you.
You're welcome.
Anne or Angie, did you have anything that you wanted to share about strategies that you're working on, or have thought about working on, or an update, or different thoughts around this root cause?
Over the last few months, with Amy's assistance, I know she just jumped off, but I was able to connect with medical providers through Henry Ford Allegiance Health, and I was able to do 3 separate outreach with clinics, with peds and women's health clinics, to do education on services that we provide here in personal and preventative health, and do, you know, like little mini presentation type lunch and learns. And they seemed very well received. In addition to actually having the verbal conversation, I was able to share, you know, tangible things in terms of resources that they can give to patients during appointments. So that was really successful. And hopefully it can continue.
That's great. What, and just for those of us, including me, what problem are you trying to address? Like, you're connecting with medical providers to
addressing kind of their racial disparities and regarding lack of enrollment. There's a significant gap regarding families of color that are enrolling in our MIHP services. So that was kind of a first step in regards to getting some outreach done to kind of promote the program. I also was able to connect with Partial to Girls, and I invited Selena Taylor to one of our staff meetings. It would have been in March. And then as a result of that meeting, I was able to connect with her outside of our group and provide her with materials to help promote our program. Because ultimately what I really envision is like identifying like a champion, or, you know, a person in the community who people can identify with, who's well respected, who is trusted, and can be that voice for our maternal infant health program and encourage everybody who's eligible, you know, to enroll, not just families of color. But that's what we really want to focus on, because there is a significant gap in families of color. I mean, it's probably 75 to 20, it's, you know, 75% Caucasian, 25% and less of families of color that are enrolling in our services. So we want to bridge that gap.
Good for you. I love that you have like a problem statement and then data to support it, right? What is the issue? Or just starting off with a why do we have this disparity, right? And then figuring out how to address it and what that looks like. And then I love I'll say I'm a social worker, so I love the community champions part because, right, it's not about me going out because I'm not the person. Like, it's about finding the people that are trusted in neighborhoods and communities.
With lived experience.
That's great.
Mhm.
Yes, because, I mean, MIHP is a home visiting program, and I'm a social worker as well. And there's a huge, you talk about the distrust.
Mhm.
We're the government coming into their home, and why you want to be in my business?
Yeah.
When we
Yeah.
really want to help, we really want to help. Our goal is not to, get anybody in trouble or, file 3200s, even though you got to explain that mandated reporter piece. We really do want to be a support to families who can benefit from our services. So really that's a huge barrier. It's the lack of trust in those government institutions.
Mhm.
So having that champion, who can be a voice, who would be willing to be a voice for our program, could really help break that down.
Absolutely. And Selena's a great voice for that. Selena spent a lot of time with Zoe, sharing her story. She shared her story with our protective services, with foster, with our staff, so that our staff understand where folks are coming from, that we do represent the government. We do represent the government who thinks we know better about how to raise children than you. And that's really not how we want to be perceived. So our staff are working very hard, and that whole engagement piece. And you talked about, trust and trusting our providers and trusting these services and building that in the community. Our staff is working very, very hard to build that, and to come alongside parents. And we've talked about that at length in other affinity group. But that's a huge issue to all of the root causes is it's trust. So having those community champions, Selena Taylor, Davita Quinn is a really good one, because she has lived experience and that them having the experience, as well as having some of the connection with DHHS and our staff in understanding what it is we're looking for, as well as how we can help those families. So that's a great connection for you.
Yeah, thank you. Yeah, and thanks for the little tip too. I forgot about her, but yes. So yeah, just kind of keeping those things in mind. And it's going to take a long time to do this. This is, you have to, it's one of those things where you can't just, okay, I talked to Selena and I gave her some information and then I'll follow up with her in 5 years. You've got to, I literally made a note to myself during this meeting, I need to email her. I mean, is there anything I can get to you? Do you need some more materials? Things of that nature. In any outreach that we do, really, you can't just, and it's hard because we're all really busy, but that one and done is not going to maintain those messages. It's, you've got to keep following up and following up and following up, because it takes a really long time to get it to stick.
Yep.
Well, and I think that this is a good conversation because I think both things can be true, right? Because I think it's safe to say that all of us on this call want what's best for the community and believe people should, I think people should trust me. Like, I'm just a trustworthy person.
Yeah.
However,
why don't you trust me?
there's also a piece of, I mean, I worked for state government for, a good chunk of time. And I had equal parts of trying to convince people that they should trust me, even though I had a state government affiliation. And also the piece of acknowledgement that some people just will not. And that's okay to me. And honestly, that took me a long time to get there because it's not personal.
Yeah.
It's not about me personally. It could be, and also frankly, if I can't relate to their situation, if I'm a an educated middle-class white woman trying to tell them something, or just frankly, being a white person in that space could be uncomfortable and not a safe place for them to be trusted. So to me, I
Mhm.
love the fact that you're saying, let's build trusting relationships. And also, I'm not trying to be the trusted person in there, right? Like there's also both things can be true. Like I would like to build relationships with people in the community. I would like to be thought of as like a trustworthy person. And also I would like to capitalize on the strength of people who are already trusted in these strong
Mhm.
roles in the community, and not try and get those people, like, to me, like that, well, I'm not gonna say dumb, right? But like that's not a smart move, and it's also not best supporting them. If they're saying this is the best way to support us, I would like to listen to that, and I would like to support that, you know, in their framework, frankly, you know, because we have, like you said, like we have this education, we have this programming that could really help them. And the barrier is we can't get it there. Then what is the middle part, right? It's building relationships, but also acknowledging that like I actually don't need them to trust the government in order to get them help. Like I just need you to know that this thing exists, and like it sounds like you're thinking of creative ways. I think that's great.
Well, and it kind of, what you're saying, it goes along the lines of thinking, don't reinvent the wheel. I mean,
Mhm.
use the resources. And I really firmly believe that Jackson is a really resourceful community. There's
Mhm.
a lot of people doing a lot of good work and really do want to help those who could benefit from it. Like the trusted advisors, that's another work group that's out there. I mean, they're doing wonderful things for people out there, and they're another identified resource, is a trusting group and individual that people can go to get the assistance that they need. So tapping into the resources or building on what we already have rather than creating something new when we don't need to.
Love it. We used to have people from the trusted advisors come, and then I know Jen took another position. We haven't had as much. I'm hoping now that, and I know a lot, they're doing boots on the ground work too. Maybe now that the world is opening up, fingers crossed, can tap into them a little bit more.
Yeah, that would be great.
Anything else that folks want to contribute? This is a good conversation. I did get a lot of replies, a ton of automatic replies. People were out. I don't know if it's still spring break time. It might be. But a lot of people said they couldn't make it today. I had like 10 emails from people who said they were planning on coming. I was like, damn, that would have been like 10 more people, but we'll get there. Okay, well, I'll click off of this page then. I'll go back to where we were and just kind of fly through the rest. Most or all, many of you have seen kind of the action planning process that we use. This is just as we're even having conversations around why people are doing what they're doing, around building strategies, using data to disaggregate data to find out why things are happening. So this is just the framework we use in our conversations and in our work. These are the 14 root causes that Amy mentioned earlier. I think all of you are familiar with these. We hope to gather more people around at least one other one. And of course, like right now, a lot of people that are coming to the Inequitable Policies and Practices group are doing internal policy work around equity or DEIJ work, which is great, but also we're having like the bias and like anti-racist work kind of emerging. So that might be a space where we gather folks. We're kind of just looking for people to let us know too what they're working on. This is just a screenshot of action plans. This will look familiar to some, maybe to Anne. And the work we can help you with if you choose to create an action plan, and how we can help support you in your strategies. And then we have a wins page. I think I did a screenshot. Yeah, we're just trying to also capture the work that people are doing. Like honestly, I mean, some of the stuff you've shared, Angie, from like previous meetings, like this thing happened and we did this thing to kind of meet the need. Or frankly, Anne, some of the things you talked to today, like like building this relationship and creating it. I know you have like an action plan that you're working on, but I think it's pretty incredible that you are strengthening relationships and building relationships around meeting a need. So, so maybe if you're open to it, maybe I'll send you like a little draft after this meeting and say like, would you be okay if we shared this statement here?
Oh, sure.
Okay, great, thanks. And also this will like, we're trying to also let people know like people are doing good work in the community. Look what people are doing, you know, and to encourage others to share. And it doesn't have to always be rocket science. Sometimes it's just like, we saw this thing happened and look at this cool thing we're doing. Oh, and this is how the back end part, but honestly, Amy and I have kind of been doing that for people because sometimes, you know, software systems are not everyone's cup of tea. And then here's just another reminder that we have like the recurring meeting. If you are not on the monthly calendar invites, you're welcome to request that, and we can send you an invitation so that every month it shows up on your calendar. We don't like to assume people want that, but if you would like, please let me know and we can do that for you and for any of the affinity groups. So our next one for this meeting will be on May 10th. And then we have Improved Trust is May 18. And then Inequitable Policies and Practices is May 26th. I put a link there for all of the upcoming events. And I'm happy to put you on the calendar for any of them. And also on the website, you can just register for whichever ones you want. And then our contact information. And I believe all of you, or most of you, have reached out or emailed and have been in touch with us. So hopefully you feel comfortable doing so. Please feel free to continue to do so. Even if something hits you after the meeting, or you're like, actually, what about this thing? So, so yeah, I appreciate the conversation today. And we had a smaller group, but I still feel like it was good, great. If you need any help making connections after this, or let me know. We'll send you an email with all the links as well and some very brief notes that I captured while we were chatting. And that's it.
Thank you.
Thanks for your
Awesome.
time
Thank
today.
you.
Good to see you all.
Have a great day.
You
All
too.
right.
Have a good afternoon.
Yeah, same to you. Take care.
Thank you.
Bye-bye.
Bye.